Good evening, everybody. I'm Sanyukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: kidney stone. Renal calculi or kidney stones are hard, pebble like pieces of material that form in one or both your kidneys when high levels of certain minerals are in our urine. Kidney stones vary in size and shapes. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls as well. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as a urinary tract infection, etc. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of kidney stone, today we have with us renowned urologist Dr. Sanath Reddy, MS, MCH Urology. He has a rich experience and hands-on expertise in urology, BPH, and stone management, and he is currently practicing at Aadhya Hospital and Kidney Care Center, Madanapalle. A very warm welcome to you, Dr. Sanath Reddy.
Thank you. Thank you for the introduction. Thank you.
Doctor, today we are discussing a very important topic, and it's important because it's very common. So, first of all, we would like to understand what is kidney stone, how is it formed?
Yeah. Kidney stones are usually formed in kidneys. They're usually aggregate of hard mineral crystals. Okay. These are aggregates of mineral crystals.
Okay. And, doctor, what are the symptoms associated with kidney stones?
Usually, patients with kidney stone present with severe pain, radiating from loin area to groin, like that, or scrotum or labia. Okay, the pain is the most common symptom which we'll be noticing. Apart from pain, patients will be having vomitings, nausea, which is a vomiting sensation. Some will be having hematuria. Hematuria in sense blood mixed with urine. That is the symptom, and some people will be having fever like that.
Okay. It can be asymptomatic as well.
Yeah. Some people will be asymptomatic. It is usually find in ultrasound findings like that. Usually found in ultrasound findings.
Okay. And doctor, what causes kidney stones? I mean, what should we do to, prevent kidney stones as such?
Usually, the most important factor associated with the formation of kidney stones is decreased intake of liquids, mostly water like that. Decreased intake of fluids is the most important reason which you will be noticing. Apart from that, high intake of salts, high intake of refined sugars, and oxalate diet. These are all the most important factors which will be associated. Apart from dietary factors, obesity, history of hypertension. These are family history is also a important factor with the renal stones, and dietary modifications in the sense to decrease prevalence of kidney stones. We should follow like adequate hydration, decrease salt intake, decrease the intake of soft drinks, decrease intake of oxalate foods like that.
Okay. And doctor, what are the treatment options available?
Most of the kidney stones are treated in conservative treatment, like with some medicines. Treatment of kidney stones depends upon factors like size of the stone, location of the stone, and consistency of the stone, and associated any infection like that. So if a stone is in a distal part of ureter, and if it is a small stone like less than 4 mm like that, it would mostly pass in urine with medication. And if stone size becomes bigger, like more than 5, more than 7 like that, the chances of spontaneous passage are less. So in that scenario, we'll be going for surgical intervention. Most of surgical interventions are now advanced, which include laser like that. And apart from size, if stone is located in upper part of ureter, chances of passage, spontaneous passage are less. So in that scenario, we'll be going for surgical intervention. And if patient is having any fever, any complicated UTI is there, If he is having any persistent pain, then we should go for surgery.
Okay. Now, doctor, as you said, first, if the size of kidney stone is not that big, then you try it with medicines. Otherwise, surgery and other options are definitely there. But earlier, people used to feel that surgery means a big operation, big. Yeah, so, and that really scares people. And many times, after even knowing that they have a kidney stone, they are quite reluctant in going and getting advice from a doctor because they are so scared of this term surgery. But as you said, there are so many advanced procedures these days that it's quick, it's easy, and it's more helpful. We would like you to shed some more light over the surgery part.
Yeah, surgical interventions for stones include procedures like URSL, RIRS, PCNL, and ESWL like that. These are minimally invasive procedures. So there won't be any cuts over the body. No bleeding. Bleeding loss will be very minimal, and like that. And advanced procedures include involving laser, involves so you'll be going through the natural urethral opening like that. So we won't be entering through your body. So we'll be just going through natural orifice. So there won't be any cut. So say after 1 or 2 days, patient won't be able to identify whether he had underwent any surgery like that. So these are advanced. Yeah, these are advanced surgeries are there. So nothing to worry. And most of the time we'll be doing like a daycare procedure. So patient or else it's 1 day stay like that. After by evening or the day after, he will be absolutely fine. He will be roaming around. He won't be having any pain. He will
They can
be
also
absolutely
join
fine.
back their work. No issues with
Yeah,
that.
yeah. Even software employees will be doing their job the same day itself. There is no
Okay,
issue with that.
wonderful.
Yeah.
And many times people ask that if I have a kidney stone, and for example, I'm, under treatment for that, maybe on medicines right now, but then would I be able to go for gym or physical exercises, or can I involve in sports, etc.? Are these, heavy or rigorous kind of physical activities advisable?
Yeah, that's advisable, but just we should look for any dehydration part. We should there should be proper hydration. Rest of the things are fine.
Many times again, people ignore the pain. I'm sure the pain is not such which could be ignored, but many times people, because they have many notions, etc., they don't go for surgeries or getting it treated. They'll go for other alternative, ways, or many home remedies, etc., or go by many sayings that alcohol will let it flush out, etc., etc. Now, what are the potential complications, doctor, if a kidney stone is left untreated?
See, if stone is in the kidney and it is not obstructing any urinary tract, there won't be any symptom and there won't be any complication. That can be left even for, depending on the stone size. If it is less than 7 mm, we can leave it alone for even some years. So there won't be any issue. If stone is obstructing anywhere from kidneys to ureter and bladder and like that, if there is any obstruction, it should be resolved within 2 weeks, like 2 weeks time. If it is persistently obstructing the urinary tract for more than 2 weeks, there will be infection will be there, and kidney injury might happen. So these are the complications. Yeah, and one more thing, alcohol flush out is not the thing. Usually with alcohol, there might be increased urine production, but in the long term, there will be dehydration and it increases kidney stone formation. Actually, that is detrimental for kidneys also. Yeah.
So that's a myth that it will flush out the
Yeah,
kidney
that's a
stones,
myth.
because many people, go for that. So that's a myth. And thanks for bursting the myth, doctor. So we have Aditi Srivastav with us, and her question is: are there various types of kidney stones?
Yeah, there are various types of kidney stones, and like calcium oxalate, calcium phosphate, uric acid stones, like that. But most commonly, there are most of the stones are calcium oxalate.
Okay. Suresh Kumar is here, a viewer, and his question is, what would be the surgery cost for kidney stone removal? I'm sure it depends, it varies, but still, if you would be able to give any, answer to him.
Can you just come once again? I didn't get it.
What would be the surgery cost for kidney stone removal?
Yeah, surgery cost. Okay. It's like depends upon the procedure, like URSL, PCNL, or ARS like that. And URSL usually cost around 30 to 40,000, and RIRS cost around 1 lakh, PCNL around 80,000 like that.
Okay. And doctor, as you mentioned that, drinking less water or less fluid intake would be one major reason of kidney stone formation. But then there are
Yeah.
people who are not aware of how much is adequate. Many times we keep on, hearing, especially in our society, that drink a lot of water. That will have their own other complications. Then there is a lot of people who go for very less fluid intake, who have very less fluid intake. So, how would you like to define the adequate
Yeah.
water concept?
Yeah. Adequate water intake depends upon a lot of factors like climate, weather, season, and body habitus, and depends upon the patient working conditions and all. So the simple indicator which everyone should follow is patient urine should be in light yellow color. Light yellow color is a best indicator to follow. If he's passing light yellow colored urine, he's absolutely fine. Hydration is enough for him. And if he is passing darker color, he should drink more amount of liquids. That apart from that, mostly what we tell patients is to consume around 3 to 4 liters of water in summer season and 1 liter less in winter season.
Okay, right. And doctor, it is said that those who had kidney stone will definitely or are more prone of getting kidney stones. So we would also like you to shed some more light on kidney recurrence or kidney stone recurrence.
Yeah, if once patient gets kidney stones, mostly 50% of them will have recurrence within 10 years time. So when compared to patients who had not got any stones, patients who had got stones have more chances of having recurrence.
Okay. So is there a way or a protocol that after the surgery or through whatever ways you take out the stone, you send it for some tests, etc., so that we are clear that what was the formation, etc., and any precautionary measure that we can take?
Yeah, for to know about composition of stone, what we'll be usually doing is to send for stone for a stone analysis. That's not a regular part of our practice. We will be sending stone for a stone analysis if there is any stone recurrence. If a patient is having the recurrent stone formation, like he had multiple surgeries previously, like 3 to 4 times like that, he's vexed up with stones. He may then it's indicated to get stone analysis done. And any pediatric population will be getting stone analysis done. And if patient wants to know about the stone composition and like that, then we'll be sending.
Okay. We have Gitika Sharma with us. Her question is, what dietary modification should I consider to prevent kidney stone recurrence?
Yeah, the first dietary modification, first and most important thing is adequate hydration. We should take proper liquids, proper amount of liquids, and decrease salt intake. Oxalate food should be decreased, and processed food and all should be decreased. And we should increase intake of citrus fruits and all. Yeah, that will be fine.
Okay. Are kidney stones equally common in children or teenagers?
Nowadays, we are seeing in usually compared to adults, children will be having less formation of kidney stones. Some some children in pediatric age group, they are with who are obese. In them, we are seeing increased incidence compared to normal children.
Okay. And doctor, any take-home message for our viewers?
It's better to prevent kidney stone formation rather than treating it once it happens. So follow all the instructions and keep your kidneys safe.
Now we just have got one question from our viewer Kalpana. I'll take it because this is what you were saying, that can I prevent kidney stones from forming? Is there a way to prevent it? What can we do in nutshell?
Yeah, if there is any family history of kidney stones, or is there any previous history, just we should be conscious about adequate fluid intake, and we should follow the dietary instructions which we had discussed previously. That will be fine.
Okay, doctor. Thank you so very much, Dr. Sanath Reddy, for your valuable time. It has been a very informative session for our viewers. Thank you so very much.
Thank you. Thank you. Thank you.
And viewers, thank you for your active and excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you.